నమస్కారం
మేడం. మీ పేరు మేడం? ఇక్కడ జూహి అనేది షేక్పేట్ లో చాలా ఫేమస్ మహిళలు విన్నాము, అందుకే మీ దగ్గరికి వచ్చాను మేడం. మీరు ఎప్పటి నుంచి ఈ దాంట్లో మహిళలు ఎంతమంది వస్తున్నారు మీ దగ్గరికి? మీ ఎక్స్పీరియన్స్ ఏంటి? మీరు ఎక్కడ చదువుతున్నారు? మీ బ్యాక్గ్రౌండ్ ఏంటి?
ఓకే, థ్యాంక్ యూ Shankaram. I am Dr. Nirmala Agarwal and I'm a senior IVF consultant and I'm in this field since the past 15 years and actually I'm in practice since the past 35 years. And I have done my graduation from Osmania Medical College and PG also from Osmania Medical College. And then I did my IVF fellowship from USA, that is Cleveland. And this I did in 2007. And we have started Juhi Fertility Center in 2010. Since then, we have been treating the infertile couples with passion. And till now, we have treated at least more than 5,000 couples. And our center is a full-fledged center, one-stop center with all the facilities under one roof for both male and female infertility. And we have facilities like we have senior consultants, ultrasound, 3D scan center, and then we have IUI, IVF, ICSI, and egg freezing. That's very, very important. Nowadays, many patients are coming for egg freezing and then embryo freezing. And then we have a very high-tech modular IVF lab, which nobody has in Hyderabad. And then we have two operation theaters, one for IVF and one for advanced laparoscopic, hysteroscopic surgeries to increase the fertility and also for other gynec procedures. And we are located at Shaikpet on the main road, just beside DMart on 3rd floor. And nowadays the problem has been increasing, I have been seeing since the past 15 years, because of the change in the lifestyle and because of the habits like smoking, hookah, and sedentary lifestyle and increased body weight. And the software people are more prone, mainly because of their disturbed sleep. They work in the night and then they sleep in the daytime, and they are exposed to radiation because of the laptops. So all these things are increasing the infertility for both male and female. And I have seen that nowadays even young patients, they are coming with the premature ovarian failure, wherein even at the age of 30 years they have very low ovarian reserve or number of eggs, and when they come for treatment they have to go for egg donation. So what I want to convey to all the patients, once you are 25 and you are married, at least get one fertility screening test done, so that we will know if there is any problem in female or male partner, we can address to that. And second thing is, if suppose they have been trying for pregnancies for about 2 years, 3 years, better not to keep quiet and better not to go to any quacks, because there you'll be wasting a lot of your time, your energy, your money, and you won't get the desired results. So it's always better to consult the fertility specialist, wherein you'll get the correct guidance and correct test, and the line of treatment also will be decided better by them instead of wasting your time and money.
Well, nowadays other different hospitals, what is the difference?
See, whenever you want to decide for IVF, you should know where to go. It's very, very important. Not all the centers are same. So when you are screening or when you are checking where to go, you should see one thing is, who is the consultant IVF doctor there, how much is her experience, and how is the center, is it well equipped with all the facilities, and is it a very aseptic lab or not, and who is the embryologist, whether it's a senior person, experienced person or not. And then do they have all the facilities like laparoscopy, hysteroscopy, male infertility, all under one roof. So and then their record of success rate, it's very important. And then you should check the reviews also, how the patients they feel when they come to center. So in our center, our patients are very much satisfied. And just check all these things, like how old is the center. Suppose they have a good track record of success rate and their patient satisfaction, and how is the lab, you should see whether it's a high-tech lab with equipped with all the latest machines or not, and who is the doctor who is going to treat you, how much is her experience and where she was trained, and then who is their embryologist, what is their qualification, and how is the success rate, whether they are doing blastocyst culture or not. So all these things first you should check and then go to the center. Not all centers are same. This is very, very important.
Madam, how many years hospitals this time?
We are here since the past 15 years, and initially for the first 20 years I was practicing obstetrics and gynecology. So I have a total experience of 35 years plus.
Madam, before in study time, how many struggles, and after side many hard work. That time you were help mother and father. How is your support your mother and father?
I always had very good family support. That's the reason. And then before marriage also, after marriage also, my husband is also a doctor, and then my two daughters are also doctors. So we are all doctors family. So I didn't have much trouble in getting help and pursuing my career.
Okay. How many employees
Yeah, we have about 20 employees, and like we have about four doctors and one embryologist, one andrology technician, and then we have urologist, and then we have a laparoscopic surgeon, and then all the other supporting staff.
No, your doctor choose the right choice, choose any choice.
Pardon?
డాక్టర్ సైడ్ వాడితే మీరు మీ తల్లిదండ్రుల కోసం వచ్చారా మీకు ఫ్యాషన్ తో వచ్చారా డాక్టర్ సైడ్
Atla. See, I was very passionate, and then in my grandmother's family, all are doctors. So I was inspired by them to become a doctor. And plus, infertility is my passion. Whenever I used to see the child is female crying, I used to get emotional. I used to think we should help them out, because infertility is very big thing in India. It disturbs not only the couple but even the whole family. So I thought, why not to just pursue the career in this field and do our best. Whatever best we can do, we should do for this to help these patients.
మేడం ఇప్పుడు ప్రస్తుతం మీరు ఒకవేళ మీ బీదలు వస్తుంటారు, రిచ్ ఫ్యామిలీస్ వస్తుంటారు, అలాంటి వాళ్ళు ఎట్లాంటి మీకు బాగా జనాలు కనపడుతుంటారు, ఎట్లాంటి వాళ్ళు వస్తుంటారు?
Atla kaadu, we have all the classes of patients, poor, middle class as well as rich class. And then for the poor class and for the medium class, we have flexible charges. It's not that the charges are fixed for everybody, depending on their capacity. And then we have an EMI facility also. Those who cannot afford one-time payment, they can avail the EMI facility and pay the payment over a period of 1 year.
ఇప్పుడు చాలా వరకు పాప కానీ బాబు కానీ
Yes, this is very, very important. All the people should understand infertility is not just a female problem. This can be because of female, this can be because of male partner, it can be because of both. So whenever you are going to see a doctor, both the couples, they should go together and get their fertility assessment done. This will be done just in 1 day. And on that day only we can come to a conclusion that whether this patient needs a simple treatment or an IUI or an IVF. So just if the visit just for 1 day, we can assess the couple and then give them the choice.
ఇప్పటి వరకు ఏదైనా సర్వీస్ ఓరియంటెడ్ కానీ లేదంటే ఎక్కడన్నా అట్లానే ఏమన్నా స్టాల్స్ కానీ ఎట్లా పెట్టి పబ్లిక్ అవేర్నెస్ గురించి కదా?
We have done a lot of camps, especially in the districts and suburbs of Hyderabad, and then we have done a lot of videos also for the patient education. And whenever the patient comes, we give them a very good counseling.
Okay. నెక్స్ట్ ఫ్యూచర్ లో ఇది ఇంకా వేరే సెంటర్స్ ఏమైనా మార్చే అవకాశాలు ఉన్నాయా?
No, I'm not planning for multiple centers, because I want to focus only on one center and give my best. And then here we are doing, patients should know the difference between what is a day 3 transfer or day 5 transfer. Here we try to do 90-95% of the patients we want to do day 5 transfer. That is a blastocyst transfer, and this you can get only if you have very good lab and if you have very good doctor, a clinician as well as an embryologist. So we always do the blastocyst transfer, and then nowadays we have started doing the frozen embryo transfer cycle. With FET cycles, the success rate is even more. And then third, we have the facility for laser assisted hatching, then all the laparoscopy, hysteroscopy, and then PGT, ERA, and then egg freezing. I want to talk a little bit about egg freezing. See, nowadays because of the career problems, or the females also are very much career oriented, and they don't want to get disturbed in between by marriage or pregnancy. So if they want to delay marriage, but then the biological clock is ticking. So if they want to delay the marriage, better is they should come for egg freezing. So then whenever they get married, they can use those eggs and plan for baby. And if the woman is married, then best is they should come for embryo freezing, and then freeze the embryos. I can freeze for about 10 years also. So whenever they want, they can go for embryo transfer. So it's a very good thing. The patient should understand. Don't delay your fertility chances after 30 years, and maximum is after 35 years. So if you are between 30 and 35, you think of either egg freezing or embryo freezing, depending on whether you are unmarried or married.
మేడం మీకు ఒక లేడీ ప్రెగ్నెన్సీ అని తెలిసాక ఎలాంటి కేర్ తీసుకోవాలి?
See, there are a lot of myths about IVF. Patients think IVF is painful. It is not painful. IVF is a very simple procedure, and it's all totally outpatient procedure. No need to admit anywhere. There is no pain anywhere. And after embryo transfer also, we don't advise patients to take rest. The only thing is they should take the medication properly for about 2 months to support the implantation of the embryo. But there is absolutely no bed rest. They can go back to their work like how patients do abroad. When I was in US, I used to see after embryo transfer only they used to go back to their work. So there is absolutely no need to take rest.
మేడం ప్రస్తుతం రూరల్ లో ఉండే మహిళలు కానీ డైలీ లేబర్స్ కానీ వాళ్ళు ఫ్రీగా ఏమంటారు ప్రెగ్నెన్సీ పిల్లలు ఈ సిటీలో ఏమంటారు సిటీలో వాళ్ళు ఏమంటే కంపల్సరీ సిజరీన్ కంపల్సరీ అంటే డాక్టర్ ప్రాబ్లమా లేదంటే హాస్పిటల్ ప్రాబ్లమా మహిళల
అట్లా కాదు చూడు దిస్ ఐవీఎఫ్ అంటే ఇట్స్ ఎ వెరీ వెరీ ప్రెషియస్ ప్రెగ్నెన్సీ. After a lot of efforts from the patient, from the doctor, you get your pregnancy. So they can go for normal delivery also if everything is fine. Like if the BP is normal, the baby size is average and the pelvis is very good, no complication, then they can go for normal delivery. But if there is even a slightest problem, we suggest them to go for cesarean because these are all very precious babies. We cannot take any risk. చూడు మన దగ్గర కన్సల్టేషన్ ఫీజ్ అయితే 800 రూపీస్ ఉంది. కానీ ఇఫ్ ద పేషెంట్ ఇస్ పూర్ ఐ కెన్ గివ్ ఫ్రీ కన్సల్టేషన్ ఆల్సో, నో ప్రాబ్లమ్. అండ్ ఇఫ్ దే వాంట్ టు కమ్ ఫర్ సెకండ్ ఒపీనియన్ ఆల్సో వీ కెన్ గివ్ దెమ్ ఫ్రీ సెకండ్ ఒపీనియన్. అండ్ దోస్ హు ఆర్ రియలీ నాన్ అఫోర్డింగ్ we have a different package for them. Like for others, if I have a package of 1,20,000 and with injection separate, for these patients I can give a package of 1 lakh only for IVF procedure. So we are very flexible. If patient cannot afford, we have different packages for them.
మేడం ఎక్కువ ఏజ్ గ్యాప్ వస్తుందా ప్రాబ్లం ఎక్కడ వస్తుంది?
Most important is age is very important for the success. Andukani if suppose they cross 35 years, the egg quality, the egg number, all everything will come down. That's why we suggest them to come early. As if the patient is young, the younger the patient, better is the success. They should not delay after 35 years.
Okay, మీరు ఒక హాస్పిటల్ నడుపుతున్నారు. ఇక్కడ ఉన్న షేక్పేట్ కానీ జూబ్లీస్ కానీ బంజారాస్ కానీ డిఫరెంట్ రౌండ్స్ చూడండి. పబ్లిక్స్ కు మీరేం చెప్పాలనుకుంటారు?
See, I want to give only one message. One thing is whenever you have been trying for pregnancy for 2 years, then better to go for a screening test at least if you are young, so that we will come to know do you have any problem or not. And once you are above 30 years, you should try only for 1 year and go to the doctor and get yourself checked, both wife and husband. And if there is any problem, we should address that. If there is any major problem, let them go for IVF, because IVF is not the last option. IVF should be considered whenever you have problems, like if you have blocks, tubal block, if you have very big fibroid, if you have zero sperm count. Even for zero sperm count, we have lot of procedures and we can extract the sperm and do IVF and they can have their own baby. We have done lot of such cases. And if the count is very low, we can give some medicines to improve the count. And then if the female has any tuberculosis in the past, then she should go for checkup very early, because the uterus and tubes both will be damaged. So my message is, don't sit at home once you have been trying for 2 years, and 2, don't go to smaller clinics or any quacks and then waste your time, money and energy. Go to a specialist and get yourself checked. And 3rd, don't cross 35 years. It's very important. The fertility declines very fast after 35 years. And 4th, if suppose a doctor says anything, just listen to them and believe them. And 5th, IVF is a very simple procedure, not painful. It has got very high success rate, around 60 to 70% in the first 1 month, which no treatment can give. So think of that. Don't be afraid of IVF.
మోస్ట్ ఇంపార్టెంట్ ఇప్పటి వరకు సక్సెస్ మేము మేడం దగ్గరికి వచ్చాము, మాకు ఇట్లా చిల్డ్రన్స్ ఎట్లా మీ దగ్గర సాటిస్ఫాక్షన్ హ్యాపీనెస్ మీరు వాళ్ళు మీ దగ్గర షేర్ చేసుకునే టైమ్స్ ఉన్నాయా?
Yeah, when they conceive, they feel really very very happy, and then they give reviews, and then they give the feedback, and then they come and show the baby. So we always keep a follow up how they are doing, and then how is the baby. So they really definitely they think it is a miracle, and usually what they say, you are our God, although it's not right, but we are only the mediators. So we just help them to conceive. Ultimately, it's a God's wish.
ఫ్యూచర్ లో ఇట్లా అవేర్నెస్ కార్యక్రమం కానీ మీరు అదే ఒక ఇప్పుడు వెల్ సెటిల్ హాస్టల్ మిడిల్ క్లాస్ పూర్ పీపుల్స్ కానీ అడ్వైస్ కానీ ఏదైనా క్యాంప్ కానీ ఫ్యూచర్?
Definitely, we are doing regularly camps. We are doing every month. We do one camp, and those who come in the camp, we give them a very good package. Like instead of say 190, which is our package with medicines, for these patients I can give them only for 160 or even 150 also, no problem. They should not like withdraw themselves because of the cost. So we are very flexible. If you have any problem or if you are advised IVF, please consult us. We'll give you at a very discounted rate.
మనం ప్రెగ్నెన్సీ స్టార్ట్ అయ్యాక ఫుడ్ ఎలాంటిది తీసుకోవాలి డైట్?
See, when you become pregnant, you are like any other pregnancy patients. There are no special instructions except that you should take a good hygienic food at home. Don't eat outside. Take more of proteins and then take less of salt, oil and chili. So these are the only instructions. That's all. They can eat everything. No restrictions.
లాస్ట్ క్వశ్చన్,
Yeah.
మహిళలకు న్యూ పీపుల్స్ న్యూ కపుల్స్ వాట్ యు అంటారు?
Yeah, for new couples, that's what I told you. If they are young, they can observe contraception for about 1 to 2 years till the time they don't want to plan pregnancy. But if they are above 30 years, they should not restrict the pregnancy for more than 6 months to 1 year, and they should like get themselves checked. Is there any problem or no? Whether they can wait or not? Because even if you are menstruating regularly, you may have problem in the uterus, you may have problem in the ovaries. So always after trying for 6 months to 1 year, go to the doctor, get yourself checked. Whether some intervention is urgently required or not, at least you will come to know that.
థ్యాంక్ యూ.
Thank you.